And that's exactly the goal, but I mean that is a challenge in and of itself because often the digital divide mirrors the health divide and the employment divide. Often the communities that are excluded in one way are the same ones that are excluded in the other ways. So we have a saying which is that e-government, the public services in general, have to go to the citizen, not the citizen to e-government. So there's very interesting work going on in the member states because I mean they're the ones who are actually delivering the health care, and we're working to assist or on cross-border legal frameworks on ways to deliver a service through instance through the ATM, the money distribution machines, or to looking at satellite television where that's more prevalent than internet coverage. And this can be specific to regions and to countries. So experimenting, learning from best practice, but most of all serving the citizen, and in other cases, if it's the private sector, the consumer. This is one of the advantages of digital, that it does allow to personalize healthcare much better, which you can also see in other contexts, the British person who has retired in Spain or the person working in the City of London from another country. But obviously the migration crisis is one of the main areas that we have to think about on the policy level in Europe. So I mean EID, electronic identification, there's an initiative that's starting in that area to see if we can help again those communities that are having the most of this responsibility, and then obviously in delivering the healthcare. But this, personalized possibility, or not even just to one individual, but to groups by language, by particular health issues that they might be facing due to their age, due to their gender. I mean, digital is making more and more of this possible, this kind of targeting. Well, first I'll say that I agree with you. We shouldn't stereotype. There's also people, for instance, who are engineers, etc., and who are great with the digital technology, even though they're older than we are. On the other hand, unquestionably, there are people also who are suffering from, for instance, failing eyesight, less dexterity, and issues like that. And we have to make sure that the digital tools are accessible to them. We have to make sure that they have some help in learning how to use them if they're not the people from the more technical background or who have been early adopters of these things. Again, it's part of an inclusion agenda, the public services going to the citizen. And again, this is mostly by our member states and our local health services, the NHS here, but we can help with best practice, we can help with funding innovation and research programs, and we can fund the Connecting Europe facility on linking for the person who's traveling, who might be, the more active retired person coming from here to Spain in the winter, that they still have access, if they need it, to medical device in their own language with their own GP, if possible in the future, or once we have a greater take-up of e-prescription across the whole union, which is already successful in a number of countries, that the person traveling abroad has access to their e-prescription in every member state. Part of it is patience and patient investment, and not patient as someone being treated, but patience and being ready to take the time. I mean, the digital health, we have the evidence that it does save money, but it doesn't save money the first year. It's part of a change in the healthcare system, which is the responsibility of the member states, but the free flow of the technology and the free flow of the data is something that the European Union can help with. So ideally, when a health system is being made more accessible, more apt to have the patient be an empowered partner in his or her health care, the technology can play part of the role, but you have to be ready for an investment to change the way that the care paths are going, the way that the outcomes are measured, and then there will be the results in a time period. So it's really having the patience to invest, to implement, to change, and to take the time to do this in a patient-centered and also health professional-centered way that we're meeting their needs.